Namaste again. This is Srinivas Samadhinalli. Let's get back to health data. So we'll continue with the challenges. So we talked about earlier the infectious diseases are the pandemic, the risk of pandemics, and also non-communicable diseases are the lifestyle-related issues. So now we'll get into the other major challenge, that is a healthcare cost, and these costs are increasing, and it's putting governments and general public into very difficult situation all over the world. So let's get into a little bit of details. Since we have data for lot more data for developed countries, I will take that as a reference, and we'll also get into details in about India, but to the extent possible. But this should give a kind of trend that's happening in the developed world, and we will be in similar boat shortly. Okay. So as you can see here, the costs have been increasing significantly across the world, healthcare costs. On one side, you can think that okay, this is these costs are becoming too much, and governments are struggling to handle them. Government and general public are struggling to handle this kind of cost. On the other side, it's good that governments and general public are spending a lot of their wealth and income on the health and healthcare, which is good thing, right? So they want to lead a quality life, live longer, and so it generates a lot of employment as well. So that there is both side, both I mean there are two sides to it, but in general, so it's becoming increasingly financially unsustainable. And you can see that in the 1960s, most of the developed world spent anywhere from 1 to 3%, 1 to 3.5% of their GDP for healthcare. 1 to 3% of the GDP for healthcare in 1960s. In 60 years, that increased almost 4 to 5 times. So most of the countries now spend anywhere from 8 to 10%, 11% in the developed world, right? So US is completely out of the league, this league. That's why I didn't show this in the same chart, because we put the US, all these things become kind of difficult to understand, right? So as you can see, the costs are increasing from 1 to 2% to all the ways reaching up to 11%. And most of the countries are increasing as the time progresses. Um, so what are some of the major causes for this one? So aging population, inefficiencies, corruptions, inertia, lack of macro level innovations are all adding to the cost. And of course, and also it's we have more sophisticated care, so whether it's equipments or medicines, etc. So those are also adding to the cost, which I have not mentioned here. I should have mentioned that here. Okay. And let's look at the health, US, United States, healthcare situation. It's really, really very difficult situation. So their health costs increase from $500 billion. This is inflation adjusted. It's not $500 billion back then. In fact, the whole of the US economic size was $1 trillion in 1969. It would not be $0.5 trillion then. It is the $0.5 trillion equivalent based on the current value of the current dollar. Okay? So the actual this one would be less than 200 or less than $200 billion. Okay, so with inflation adjusted, the U.S. government was spending. I mean, U.S. was spending $500 billion on health in 1970, and it reached $4.9 trillion in 2020. That's how much you can think about it. It's almost 10 times increase in this one in just matter of 75 years, 73 years. No, sorry, not 70, 53 years. Okay. So again, what are the causes? Again, increased population, US population has increased by there are more aged people there, and then increased costs. So that is with the more sophisticated equipment, and more salaries for doctors, nurses, and etc. Right. So all those things are adding to this cost. Uh, so as a percentage of GDP, it increased from 7% from 1970 to this one, nearly 18%. This is really, really not financially sustainable. They have to do something. Okay? So we don't know what they are going to do. As we know, as of now, Trump has put Doge, Department of Government Efficiency, under Elon Musk's leadership. They're trying to do something. So we'll have to see what comes out of it. Okay? Per capita spending increased from $2,000 to 14,000. Again, 7 times increase in the per capita spending. So one positive thing in the overall thing is uh, out of pocket spending was 32% in 1970. That has come down to 10%. And this is a really positive thing, because there will be lesser burden on individuals and families, so there's a lesser chance of people slipping to poverty. But still, there are significant people fall into poverty because of out of pocket spending. And if you look at the the per capita spending, as I said earlier, it increased from 2,000 to 14,700 plus. Out of pocket, people were spending nearly $700 back in 1970. Now it is $1,500 after 53 years, which is not bad. I mean, it is significant, very well contained. So it's just doubled over 53 years. So this picture gives the kind of where the funds are coming for the healthcare, between 1970 and 73. So all this data is available. You can check this link, healthsystemtracker.org. So the data is provided to some government agency, I think National Health Expenditures, NHE, and this kind of visualized and analyzed by this website. Okay. So in 1970, 32% was almost 33% was out of pocket. Private health insurance 20%, public health insurance was 22%, and others 25%. In 2023, out of pocket has come down from 32 to 10%, and private health insurance has gone up from 20 to 30%. And the biggest jump is in the public health insurance, that is the Medicare and Medicaid. There are two government health programs, health insurances, and this has increased significantly. So from 22% to 43%, nearly doubled in terms of the government expenditure on healthcare. Again, this is a big burden on the government, and again, it's in one way it's positive, another way it's very unsustainable. Right? Other sources has come down. Okay, so I think some charities and other things, so their share of healthcare has come down. Where is this money? $4.9 trillion. Just to give a little bit of the size of this $4.9 trillion. As of 2024, end of this financial year, India's GDP will reach about $4 trillion. That is, US is spending more than India's GDP on the non-healthcare for a population of 1/4 of India's population. Okay, that is US population about 350 million, and India's population is 145 crore, 144 or 45 crore. That's the 1,4 billion people, right? That's exactly 4 times the population of US. And they spend how much? They spend 4.9 trillion. Our GDP is $4 trillion. Okay, so how much we spend? Roughly about $250 billion or something. If you extrapolate that in, we are roughly about 40 times more cost effective, even outcome effective than the US healthcare system. I'll create a separate video on comparing the US healthcare in India and China, okay, and a few other countries. Okay, so looking at the where the money is going, bulk of the money is going. Actually, who is providing the money? So as I said earlier, the private insurance is providing about 30% of the money, and this $1.4 trillion. Medicaid and Medicare. So they put together about close to $1.9 trillion. That is about 42% of the total spending. And third parties, the charities and other, they spend about 571 billion. Out of pocket, about 500 billion. $500 billion out of pockets. That's still significant. So the earlier I showed you 2023 data. Now it is actually this slide I had created a little earlier. So this is 2022 data. So it's $4.5 trillion in 2022. So you can see various spending. I'm not going to walk through this one. Actually, let me go to this website and you will come to know what this means. Okay. So this is the website. They've done beautiful visualization of the data. Like any other government report, where they get the report provided by the whatever that department, National Health Spending Tracker or something. So they have provided simple word or post document, which is very difficult to understand. This website, Health System Tracker, they visualized it, analyzed it, visualized and explained the story much better. Okay, so let's wait for a couple of seconds. The old MacBook, so sorry, it takes some time to load. Here is the spending portion. So where the money is going for the healthcare money is going in US. 31% is going to hospitals. That is, I think, all the equipment, infrastructure, physicians, nurses, technicians, etc. And the physicians and clinics. This is for the outpatient care. So this is about 20%. That's very high. So these hospitals and physicians put together, that itself is more than 50%. And then the retail prescription drugs, that means outside the people who take the drugs outside the hospitals, that is about 9%. I think as part of the hospital care, that would be if you include that, that would be significant, component. And then the nursing care for old people, injured people, etc., is 4.3%. Dental is 3.6%. Home health care is 3% for people who are so chronically sick, etc., or aged population. Other health issues, 25%. Other professional services, it could be ambulance and other stuff. So it could be laboratory services, etc. Okay, let's get back to the this one. So if you look at the where how the money is being spent in US, as I said, the biggest components are hospitals and the physicians and clinics, right, and those things, and also what kind of age groups are spending how much. So that's, well, let's look at it. And if you see here by age group, how much of money is being spent by different age groups for healthcare. For 0 to 18%, 18 years, it's less than 10%. Okay, so that the age group population is about 22%. Okay, from 19 to 44, spending is about 10 to 15%. And total spending from 0 to 44 years is about 25%, but the population is about almost 60%. Okay. Highest spending is in the final, the end of life or final year. 25 to 30% of spending is is spent on the on people who are in their last year of their life. So that's less than 1% of the population take up about 25 to 30% of care cost. So this is where the moral dilemma. Do you want, how long you want to keep the person alive while you try to manage the finances, right? This is a very difficult ethical dilemma. They don't know how it's going to be resolved, but this is the biggest component in the healthcare. It's not only in US, it's anywhere in the world, including India. You go and check now, especially in the last 10 to 10 years or so, and it will continue to be more in the future. Like more, we'll be spending more and more people for older age people. It's just, where do we stop? When do we stop? It's very difficult to draw the line. Okay, but this is the very difficult situation, the problem to solve. Now, my point here is that most, I mean, 25 to 30% of the population, the total health spending goes to keep the person alive for a few more days, a few more weeks, at the maximum in a year. So That's really, really very high. And also, like you can see that which what percentage of the population uses this. If you see here, uh, top 1% of the population uses 24%. Top 5% use 51% of the total spending. Top 10% of the this population uses 67%. Okay, so what is meant by this top this one again? I'll have to let me make the remind. If 20% of the people use 80% of the healthcare spending, can we understand who those 20% are and put some prevention programs? Right? I think that's the key thing. So So again, very small percentage of the population, not that just the age group. Even in that age group, only small percentage of people take most of the this one. Right? We have to understand what those small percentage of people who are making and taking this work, incurring this cost or causing this cost, and we have to understand why that's happening. If we don't understand the causes and put some preventive mechanism, it will be the cost will explode and it will become highly unsustainable. Okay. So these are the costs in the developed world, and let's look at the what is happening in India's thing. So India's government and private health spending, right? So again, there are a lot of positive things that are happening, definitely. But and also we are in the same trajectory as the developed world. That is, with increased the age, and and life expectancy and lower fertility rate, and life, and then the cost of healthcare are increasing, and it will become unviable if we don't put some good preventive mechanisms in place, and also some innovations in place. Okay, so this is the statement from the government of India. This actually this you can see this is a press release by the government of India, and this was when was it done? I think this was done sometime a year back. Okay, so share of government healthcare spending in total health expenditure increased from 28% in financial year 14 to 40% in financial year 19. In 5 years, it increased from 28 to 40%. This is a total health spending by government. Okay, which is good. Government is taking more and more ownership of it, and people are kind of there's more support from the government. But this is a nice way of covering. It's a which government? It's a central government or state government. We'll look into it. So there's another good thing is in a decline in out of pocket expenditure as percentage of total health expenditure. It says that total out of pocket expenditure dropped from 64% to 48%. Again, these are I think mostly from some sample surveys. I will not give too much credit to or or I don't trust this data very much, but there's some amount of truth in it. Okay, so because the sample surveys they'll take few samples here and there, and it's in a huge country like us. The sample survey have to be really number of samples have to be really high, and it has to be really well planned. Increase in the share of expenditure on health in the total expenditure in social service from increase from 21% to in this one 26%. See, this is the this from the Ministry of Finance, and I think this was done sometime in financial year 23. Okay, and but the data it's nicely covers the all the spending done by state, center, and state. In fact, the bulk of the spending is done by the state. We will show that here. Okay, you can see that health spending has increased from 1,72,000 crores to 5,48,000 crores. Okay, so it says this is the combined center and state. It is not just center. Okay, increase the total spending increase from 1,72,000 crores to 5,48,000 crores. You see the next in the budget how much the money was allocated by the central government in this. You'll come to know. Okay, so how much India spends on the central government spends on this one? As I said earlier, total as of fiscal year 23, government total spending is 5,48,000 crore, right? That is center and state. Okay. Government, central government spending is only 86,000 crore. That means if you deduct the total government spending, that center and state minus central government, you will get the 4,62,000 crore. Nearly 80% of the money is spent by the the state government, but nicely central government put nice figures saying, oh, these things have happened, etc., all that, so but bulk of the burden is kind of shared by states. And assuming based on this data here, so 48% is by the government and remaining 52% by the state and the citizens. Extrapolating this to 55%. So 6,70,000 crores is spent by the citizens. Okay. So this comes to about $135 billion is the total health spent by the by India. Compare this to 2 or $3 trillion in FY23 in US, right? This is roughly about 30 times lower than US, and we have a population is 4 times that of US, right? That means almost 120 times less than US in terms of per capita spending. So you can see that, just want to show the budget lines in the central government budget lines. So the health and family welfare spending. So it was in 2021, 8,000 crores. In 2022-23 is 86,000 crores. So I'm not trying to kind of make up this number. So I've taken these things from credible sources. The link is here. PRSindia.org. We can look at the Union Budget 2022 to get the details. So in FY24, I just kind of extrapolated the same number and the budget lines as well. You can see that the central government budget has increased from 88 to 90,000 crores, barely increased, but the state government's spending have increased, so maybe about 10% increase from the previous year. Okay, so the public citizen spending continue to increase. Okay? So this is citizens and public. I think this is also should include the private insurance as well. I don't have the breakup for that. So these are the government spendings. 5,99,000 crores, or almost 6 lakh crores, and the remaining is coming from the general public. Okay. I want to just show the kind of how much money is spent by government of Karnataka. Okay, so if you see here, health and family welfare allocation is 16,000 crores. GSDP projected is about 28 lakh crores. So it's roughly about 0.6% of the GSDP spent on the healthcare. And overall, I think as a percentage of GDP spending, I think we spend about 2.1% of the GDP is spent on healthcare, both center and state, center, state, and everything put together, and the private spending all put together. Compare this 2.1% to 17% of the GDP that is spent in US. These are little data heavy. So I just want to pause it here. Key message is that the healthcare spendings are increasing across the world, and US is really out of control. Their expenditure, total healthcare expenditure, is about 18% of the GDP here, and most of the developed world spends about 10 to 11% of the GDP on healthcare. And in case of India, we spend about roughly about 2.5% of our GDP on healthcare, and so that will continue to increase with so our ability to afford this one, and also inflation in the cost. So it will be unsustainable in developed world and developing world everywhere. So some innovations have to happen, some efficiency have to be brought in, and especially bringing preventive measures so that fewer and fewer people will be, making use of the healthcare services and facilities, right? And as I said, the later age population is using bulk of the spending, and in fact, 25 to 30% of the spending in US is goes to keep the people, the old people alive for few more days or few more weeks at the maximum. So some thing have to come up so that this becomes a little more manageable. So with that, I'll pause it for now, and then we'll go to the next aspects of the challenge in the next video.